Hi, I'm Angelina Salazar with Western Healthcare Alliance. And last month in our newsletter, we talked about volume to value, preparing for the shift. We discussed various ways that hospitals can prepare for this future of value-based care. Today, I'm happy to be talking with Connie Mack, the Executive Director of Community Care Alliance. And Connie, can you talk to us a little bit more about how hospitals can prepare for this shift as we look towards what lies ahead?
We were going from volume to value. In a world now where we're looking at quality and we're looking at cost, I believe for hospitals, they really need to take a look at their cost structure. If we're going to be succeeding in the future, they have to look at their organizational cost structure, meaning their overhead, their direct cost, their indirect cost. What does it cost for them for the goods and services that they're supplying, but also looking at what it's going to cost them to provide a specific service to be successful for moving from volume to value, especially when we're looking at risk contracts on the horizon.
So who specifically is responsible for looking at these costs in the hospital?
Well, specifically, I think the role of the CFO is going to be changing. Right now, they're looking at productivity and costs as it relates to their profit margins. In the future, they're going to be looking more specifically at where their margin's going to come from when they engage into a risk contract with either Medicare or any other type of payer. So they really have to understand from the standpoint of each individual service what that cost is going to be so that they can prepare for making sure that they're going to be sustainable in the future.
So Connie, what should a CFO be looking at organizational-wide?
Organizationally, I think you have to kind of put together both quality and cost. And once you understand both of those pieces, you need to look at your service lines and do everything you can to reduce and minimize any of the variability that you have with your cost structure and with your quality. And this, in the end, is going to produce the outcomes that you need to succeed in the future.
Thank you, Connie. We appreciate that information. And next month in our May newsletter, we'll be looking more at beyond the walls of your hospital and how you can prepare for the shift, volume to value.